Hi, and welcome to And So Much More. I am your host, Cami Smith, and I am here with Carol Harvey.
Hello.
And she is a professor. She is a nurse.
Yes.
You are once a patient. Are still
Yes.
a patient? Were once a patient.
I am in remission, but still being followed up in the clinical trial.
Okay, so you still have that role as well. And so today we want to really hear your story and give you an opportunity to share what your journey looked like through your diagnosis of breast cancer.
Sure.
And so, well, first, why don't you tell us a little bit about who you are?
Sure. I have the pleasure of teaching nursing at Liberty, and that's been a joy. I've been doing that part-time since 2010, and then I went full-time in 2017. Beyond that, though, I've been a nurse at the bedside off and on for 35 years, kind of dating myself there. But I've been at Centra. I worked at Centra for a good 12 years and was actually working when I received my diagnosis of breast cancer.
And you continue to work.
Yes. My treatment started pretty quick, and so I had to stop working.
Yeah.
And then because of the kind of cancer I had, they had to hit me really hard with chemo. And so then they had to let me go. So I have not worked at the bedside since 2020. But I have been able to keep teaching. I laid that down for a little while, and then but still was able to keep teaching. So I'm very thankful, because that's such a joy of, if I can't be at the bedside, I can empower the next generation. And so I'm so thankful for that.
Yes. Oh, and I bet it's an ebb and flow, just listening to what you can and can't handle in each moment.
Yes.
Throughout the whole process.
Yes. That was hard, because, you know, I think probably we as women tend to feel like, oh, we can do it all.
We can do it all.
We can do it all.
Yes.
And so that was a little sobering, and just kind of, okay, what can I do? And just be thankful. And now on this side of it, I have the pleasure of just thinking like, I'm having a bad hair day. And then I'll say, but you know what? I have hair today.
I have survived that.
Yes. I have hair to have a bad hair day. So that has really framed my thought process a lot.
Yes. Yeah. So tell us from the beginning.
Sure.
So you received your diagnosis.
Yes. Yeah.
And then what was that journey like?
So I actually found it. I was actually behind in my mammograms. Even I, as a nurse, I feel embarrassed to tell that story, but we often don't take care of ourselves like we should. And so I was behind in getting my mammogram. So I found the tumor myself, and I knew immediately it was quite large. And so I thought, oh. And so by the time I got the official diagnosis, that was September of 2020. And then my chemotherapy started in October of 2020. So right in the middle of COVID, it was quite the experience. Family was not able to go with me into the Pearson Cancer Center for my treatments. And so it was a type of cancer called triple negative, which is a little more hard to treat. They have to treat it with chemotherapy. And then I had surgery and then radiation. So when I started the journey, they asked me, there was a clinical trial going on involving a immunotherapy agent. And so they asked if I would consider participating in that. And so that, as a nurse, I was like, I'm aware of clinical trials. And so I wasn't afraid of that term, but at the same
I was going to say, what is that like to step into something that feels experimental when it is your life and your health that's at stake?
So interesting, because as a nurse, I've talked to patients about that before from the nursing perspective, but now as the patient, I thought,
so different.
So different. And as a side note, my husband is also a nurse.
Oh, wow.
Yeah. And so, you know, he and I both really were like, we knew the benefits and also perhaps the risks of that. And so anyway, we did some consulting with some really good friends of ours, one of which is a pharmacist and has worked in clinical trials, oncology trials. And he was very supportive of this. And and so it was such a gift to have that. He said, if it was his wife, he wouldn't even think twice. We would have her participate in the trial.
And that is some strong feedback.
He really had the gravitas to think that through, like thinking through his his own experiences in the pharmacy side of running that. And his rationale, which we just have experienced ourselves, was that when you participate in a clinical trial, you are just observed so much more closely. Not that regular patients are not, but it's like the monitoring is taken to a whole new level.
That is, I have never thought about it that way.
And he was absolutely right.
Wow.
For example, had I not participated in this, I would not have had echocardiograms. And thankfully, I had no problems with anything. But even if I had the echocardiograms, I think I had 3 done, 2, I can't remember now, but several echocardiograms that were monitoring to make sure my heart function didn't fail or have any issues. Mm-hmm. And so that was such a neat experience to just know, like, oh, I am really being watched even more closely because of this experimental drug that I was perhaps on. It was what they call a double-blind study. And so I don't know whether I received the actual medication or not.
Okay.
Yeah, but my outcomes were so great that they kind of think I probably did.
So you don't even find out at the end of the clinical trial?
Like I will never know.
I did not know that.
And my doctor didn't know either. However, she said, I have responded so well to, like, my tumor immediately began to shrink. And because it was very palpable, they could tell the size was diminishing. By week 4 of the treatment, it was being treated every week.
Wow.
For 12 weeks and then every other week for another couple months. And so anyway, the tumor just shrunk by, I think, week 10 or 12. It wasn't even palpable anymore. And it was a really good sized tumor prior. Yeah. So I just thought that was such a blessing to be in this trial. I was very thankful to have had that experience, to have the extra monitoring. Additionally, the team, the research team, was amazing to work with, just so helpful. And in a season when, even when it wasn't COVID, but anytime you go through cancer, it is just such a unsettling time.
Yes.
And to have their extra help, their extra eyes, their extra voice in just helping me navigate everything was such a blessing too. So if I were to go through the whole thing again, I would jump into a clinical trial again. I mean, obviously I would pray about it, make sure that was the right decision, but I would do it again 100%. Wow. Yeah, so thankful for that.
What did your care team look like? So I hear you say your research team.
Yes.
And I imagine that is outside of your core care team.
Correct.
So what was your team made up of?
So the team was made up of a surgeon, and Dr. Block was amazing, just wonderful to work with. And then my oncologist, and then later on a radiation oncologist was involved as well.
Okay.
I can't remember if I met her before we got started on all of that. I think perhaps I was through the chemotherapy when I then met with her.
Okay.
And then we had the navigator from the Pearson Cancer Center, who is a nurse navigator. There were several of them.
Their team is phenomenal.
Phenomenal and so helpful, and they just helped to get those appointments set up, answer my questions. Yeah. And so those were the core team. But then the research team was an additional extra level of involvement. So I really did feel extra cared for.
Yes, that's just a lot of eyes to have on the data, and
correct.
That's incredible.
Yeah, and so I am still a part of this trial. It's a 5-year follow-up trial. And so honestly, I don't know if my follow-up now, I am 3 years now post-op or post-treatment. And I don't know if I would still be doing every 6-month follow-up or not, but that is part of the trial. So really almost every 3 months I'm seeing somebody. So I just saw my oncologist last month with the research trial team there with me, still following up, seeing what kind of symptoms I'm having, or if I'm having any symptoms. Thankfully, I've not had any symptoms. And then, so I see them like every fall and spring. And then in the winter, I usually see Dr. Plock. And in the summer, I see the radiation. So almost every 3 months, I'm seeing someone.
You're seeing everyone. Okay.
Yeah. So I just feel very eyes on Carol. And so,
that's as it should be.
Yeah.
I mean, that should be the experience of every cancer patient, every patient really that comes through Centra.
Yeah.
And I love how broad of a team that you have.
Yes.
So how do you feel now?
I'm feeling great. It has been really, the first year after chemo was a little rough, just trying to get my feet up underneath me, my endurance. I actually felt a little slow. They call it chemo brain.
Okay.
Yep. And so the team helped me get set up with cognitive therapy. And it was phenomenal. So I would go every week for cognitive therapy training at the Baptist. And that was so helpful.
Wow.
And I did that for not quite 3 months, but it really helped kind of clear the fog of the chemo brain. And so I feel my endurance is better. So I feel the 3 years out, I feel almost the same as I did going into chemo.
What a huge blessing.
Yeah, very, very thankful.
So how many other areas within Centra over the continuum of your care did you interact with?
Ooh, a lot because of the extra tests that we had done.
Yes.
So I worked with, I had to go to cardiology a couple times for the echocardiograms, which I mentioned, which is, in case you're not familiar with that, that's just a kind of a test of the heart.
Okay.
And so then I had several ultrasounds, bone scans, different things. So some of those were at the radiation, I can't remember what, the imaging place on Nationwide.
Yes.
Yep. And then some were actually at Lynchburg General. My surgery was done at the Baptist.
Okay.
Yeah, the Baptist.
Okay.
And so I've kind of been across the care continuum, but a lot of it was done. The radiation chemo was all done at the Pearson Cancer Center, which was wonderful. Yeah.
I love that.
Yeah.
Well, and it's just such an incredible picture.
Yes.
Of the care. There's so many different areas within Centra. You don't come in and isolate yourself as I'm a cancer patient. This is what I do. This is where I go.
Yes.
It is a one Centra approach to your care. All of those eyes, again, so many eyes. Take all eyes on Carol.
Yes.
That's so wonderful.
Yeah.
So what message would you have for someone who's maybe at the beginning of this journey or just currently going through maybe even the thick of it?
Yes. Well, I would say, first of all, I'm so sorry for what you're having to go through, but I found my cancer experience to be so enriching. I feel like I am such a better person on this side of cancer than I was beforehand. I feel that I'm just much more sensitive to people and what they're going through. And it really made me a more holistic person. My faith was very challenged in a good way during this whole thing, and really felt closer to the Lord through all of this. And so I would say that as you're starting out, there is a lot of resources here at Centra, and that the team here is truly for your good, and that they are looking to help you. And so I would just say, if you have questions, reach out. And if they offer a trial, don't just take it because I say so, but really delve into it and ask, okay, well, what is the extra monitoring and what will that entail, and how much, what kind of benefits are there? There are risks to being involved in those things too. So you want to take those seriously as well.
Yes.
And so I don't want to minimize the risks that could be with really any, not just a research trial, but any of the treatment therapies that you might have. But at the same time, the treatment plans that Centra has are truly so well-grounded and will really be for your benefit. And so lean into the expertise of your care providers, and just to have hope in this, because there's so much gravitas to what their knowledge is and their knowledge base.
Yes. So, I like the word hope.
Yeah,
for sure.
A lot of hope.
Yeah, and it sounds like this was an opportunity for you to take roots you already had and push them down deeper.
Yes.
To really ground yourself in this whole experience.
Yes, very much so.
I mean, things like this that knock us off our feet, you never know how it's going to impact you. And so
correct.
Just hearing the positivity from your experience is really encouraging.
Yeah, truly. It was such a life-changing moment, and it has really reframed my perspective. Like I said, when I have a bad hair day, I think now I have hair. Praise the Lord. I'm so thankful for that. So I really have found this to be such just a broadening experience for me. And while it is a hard thing to go through, and especially during the time of COVID, and it was so isolating, friends couldn't come over, and those kinds of things, it was really isolating. At the same time, this side of it, I just look back and think, wow, I can do hard things.
I can do hard things, yes. That is a good message.
Yes.
Well, thank you, Carol, for coming in and for just sharing your wonderful story. And while I'm sorry that this is something you had to go through, just hearing you say that you are almost at a point where you're grateful. There's so much hope on the other side.
Yes,
so
very much so.
Thank you for sharing that message.
My pleasure.
And thank you all for joining us on And So Much More.